You are watching the Doctalk show.
Welcome back. In your younger days, you might have heard from your elders or from your teachers to abstain from sex, lest you will acquire sexually transmitted diseases. But what exactly are these diseases they call STDs? Well, our doctors in studio will tell us more. So, Dr. Chigundu, in particular regard to STDs, we know it's a type of genital infection. What exactly are these STDs?
Thank you very much. STDs are sexually acquired or sexually transmitted diseases. And these diseases actually occur from the common infections. And these common infections in our population are those infections that can cause discharges. Then we have infections that can cause wounds or ulcers.
Wounds or ulcers.
Yes.
So those are the main two.
Those are the two broad categories.
Those that cause discharges, those that cause ulcers. And among the very common diseases that cause discharges is one called Candida. So Dr. Sematimba, one who posed a question, is Candida an STD? One of the most common questions I'm sure you interface with your patients in the clinic.
Thank you. Is Candida an STD?
Yes, because it will cause a discharge.
Well, yes.
Dr. Chigundu said to cause either a discharge or to cause an ulcer or a wound.
So I think that those are some of the myths we need to break. Candida is not an STD.
Okay, how so? Because
Candida...
there are those which are not STDs but can cause discharges.
Exactly. Now, Candida being one of the commonest manifestations of a discharge, people think it's sexually transmitted.
Yes.
But Candida is caused by an organism which is acquired from a fungi, which is acquired from the environment.
From the not sexually transmitted.
Not sexually transmitted.
From the environment. How does it reach? Now, how does it come from the environment?
Exactly.
Into the
the
discharge.
Being the design of the female tract, it's crowded somehow and provides that environment, culture, warmth, and all those things for this Candida. It's called Candida albicans to flourish. So it's basically a fungal infection that is acquired from the environment that sometimes overwhelms the body and then manifests as a whitish discharge that is like spoiled milk. Yes, usually like cuddy, spoiled milk. It also causes itching, and women can itch and scratch. So sometimes it becomes red actually. It can be very uncomfortable when they itch and scratch.
But it's not an STD.
It's not an STD.
Okay, so which are the STDs then? If Candida is not, at least demystified, we have thrown light that Candida is not a sexually acquired infection or sexually transmitted disease.
Yes, actually, when someone has it, you don't have to treat their partner.
Okay, because most people will say if the wife has Candida, the man also has to go for treatment.
Exactly.
So
maybe also to elaborate a little bit more before we go there, for the fact that Candida is a very common manifestation, and the biggest reason why most of these women come to us. We need to know that Candida is really more of an optimistic infection. It takes opportunity for when the immunity changes. Candida will grow. In some research, we really found out that actually most women have Candida, the organism, that fungus colonizing the vagina. It is only that it is kept in check by the environment. Physiologically, a woman's reproductive tract is supposed to be acidic. And what makes it acidic is a special type of bacteria called lactobacillus, which is naturally a resident in that area. Now that bacteria, that bacteria produces a moderate amount of acid that keeps off other organisms from growing. It is normal, including Candida. Anything that changes the environment, that changes the growth of that organism or suppresses that organism called lactobacillus will reduce the acidity of the vagina and candida will grow.
So,
Some of these things,
what are those common things that can change the woman's environment and make
yes,
the candida come?
common changes are hormonal, especially pregnancy. During pregnancy, the environment changes. The acidity reduces, the vagina becomes more alkaline, less acidic, and this favors the growth of candida, of that fungus, which now becomes a disease. Women who have immunosuppression of any sort, you can have immunosuppression because of previous disease. HIV is very common. Diabetes, when you have uncontrolled sugars, they will alter the environment, and candida is actually quite common in women with uncontrolled diabetes.
Is it true that some people think going to the toilet, you know these toilets, the public toilets, they commonly say this toilet, because of the hygiene conditions, they got candida. How true is that?
Actually, that's not true.
That's not
to
true.
be realistic, that's not true. Candida is not acquired. It could be a conduit, but we don't usually say that someone used the public toilet, they are getting candida. It's not very true.
Okay.
Yes.
Picked off toilet.
So it's not picked off toilet. Yes. Some practices like douching. Douching is the ladies who clean, they go up. Yet cleaning is supposed to be where you see on top. Is it
Cleaning the outside.
Cleaning the outside.
Not cleaning the inside.
They go inside, use like 3 fingers, go clean. They scrub. They go an extra mile. Actually, that changes the environment and gives room for candida to grow.
Especially using detergents.
Exactly.
Like soaps,
Yes.
these hygienic products which have chlorine in them. It really alters that bacteria, kills it, and gives chance for candida to grow. Actually, we've found out recently that the irrational use of antibiotics, especially in Kampala, has caused a lot of problems.
The antibiotics.
Exactly.
Could you throw more light on that? How are the antibiotics? I know many people, like, whenever people fall sick, they will first say, I don't want to take some, azithromycin or some antibiotic. So what is the effect of antibiotics on
Incidentally, every
this
woman
candida?
in a population has used antibiotics at a certain point. First of all, the antibiotic sweeps and destroys the normal bacteria. They're supposed to guard the vagina. So the acidity will go down and favor candida to grow. Then you have antibiotics actually quite irrationally used even in poultry. There's a lot of antibiotic use in poultry, chicken farming. And these birds are given a lot of antibiotics, and we consume them, more so the women.
So basically we're eating
So the
antibiotics
resistance,
now?
yes.
And getting,
Comes
the
back to the
ladies are getting
human.
the infection.
Yes. Yes.
Not that they're acquiring the infection sexually, but it is what they are putting in their system.
Exactly.
The antibiotics they buy from the pharmacy or the food which is...
And the clinicians and the health workers have not helped that much, because every time a woman walks into a medical facility with a vaginal discharge, they pump her with more antibiotics without even examining to know what. But candida is not treated with antibiotics.
But coming back to STDs now, what are the common STDs we now?
Oh, before we go to
see,
STDs,
yes.
there's something very small that we need to mention. There's something called bacterial vaginosis.
Okay.
Actually, it's as common. It could be as common as candida, and usually it's also an imbalance, like my colleague has said. It's an imbalance in the flora, in the microorganisms. So when this microorganism is overpowered, the lactobacillus, you can get other organisms growing. So you get what we call bacterial vaginosis, which presents like with a frothy, foul-smelling discharge. Yes.
Is it done? It smells like almost a fish.
Exactly.
Smell, the fish smell.
And usually the smell is increased or is exacerbated by sexual intercourse.
Okay.
Yes.
Yeah, one of the things that I usually tell women is that largely, of course, the vaginal tract is supposed to be moist. It's supposed to have some sort of discharge. It's a wet area. It's not a dry area. So if you find yourself that you're having an excessively abnormal, actually in terms of quantity, if you find that a discharge starts to stain pants, it could be abnormal. If a discharge changes color, then it could be abnormal. If a discharge is bloody or it has an abnormal smell, then go to a doctor. Those are some of the simple things. Actually, some women have a bigger volume of vaginal discharge than others, and they would come running to you saying that it is
I'm sick, they say.
Yes,
Okay.
and
But
we even
sometimes it's
seen
okay.
women
So-
with IUDs. It's another common thing. Intrauterine devices can
we'll come
also
back
cause.
to a quick discussion on IUDs and their role in STDs, but more about this coming after the break. Please join us on our Twitter handles on Facebook, on Twitter. We'll be able to respond to each of the questions or those ideas or misconceptions you have about STDs and discharges, common discharges like Candida or the likes. We'll be right back after the break.
You are watching the Doctalk Show.